I had a meeting with a dentist today. You know, one of my favorite things to do is to meet with my dentists. And we were talking about a marketing plan for him. He called and he was very direct. Like, this is what I want. Send me a quote, send me a bid. And I was like, listen, I don't really do business that way. I don't send bids. I don't just send out, quotes. And it's not because I'm not transparent on price, but I see it as my job to advise you in a way where you don't make any mistakes with your marketing and in a way where we can be a long-term fit for each other. So some important things came up. So he basically called and said, listen, I don't want Google ads. I don't want SEO. Don't look at my website. The only thing I want to do is market for implant patients on Instagram and Facebook. So I want you to create a funnel for me on Instagram and Facebook. What does that cost? And I was like, okay, well, let's talk through this, because I'm not gonna be able to do that for you if that's not what's in your best interest. Just like with a patient, if they walk in and say, can you extract this tooth? Well, if the tooth doesn't need to come out, you can't just send them the quote for extracting the tooth. So anyways, we talked through it a little bit. I explained that there's two ways to do Facebook and Instagram marketing for lead acquisition. And I also expressed that it would be wise to compare the return on investment and expected return on investment between Facebook and Instagram ads and Google ads. I also explained the difference in nature between these two marketing methods and why there's a longer sales process with the social media ads versus the sales process with the Google ads. I also talked about a realistic ad spend and how that money should be utilized. The most important part of doing business with a marketing company is having transparency about where your money's going and how it's being spent. So we talked, and I said, listen, you need to know what other people are investing and how they're investing to attract implant leads. Have you ever done paid ads before? And it sounded like he really hasn't done paid ads before. So he's probably thinking he can throw $500 at a Facebook ad and see a bunch of implant patients. It really doesn't work like that. When people are marketing actively to attract implant cases and big cases, they realize that the new patient acquisition cost could be $500. It might be $1,000 in some instances, in some markets, at some levels of competition. But if that $1,000 brings you consistently a $30,000 case, or $40,000 case, or $50,000 case, you may not need to worry too much about that $1,000. You need to worry more about, okay, in my market, what is the lowest new patient acquisition cost that I can attain, and what's a realistic goal for me in my market? And so I talked to him about this, and I said, listen, if those numbers scare you, I'm not your person. I'm not going to just write you a proposal and take orders. I know it's how important it is for me to be an advisor. And, another thing I mentioned was, are you going after full mouth restoration cases? Is that going to be our marketing? Or are we going after single tooth replacement? And at first he said single tooth replacement. And so that's where I said, well, you need to think like the consumer. And if you're just tuning in right now, this is going to be the most important information and the biggest takeaway. You need to think like a consumer. If I need an implant, when do I find out that I need the implant? I find out that I need an implant for a single tooth after that tooth is bothering me, after it's infected or broken, and I need it extracted. So if we're looking to do more single tooth implants, really our strategy should be emergency ads. And when people have emergencies, do they go to Facebook to find a dentist for a dental emergency? No, they might message in a group and say, who do you recommend? I've got an emergency. But generally speaking, they go to Google and they type in dentist near me, closest dentist to me, dental emergency, immediate care dentist, or whatever it may be. Think like the patient. What is that process like for them? And then they go in and then they learn about their options for the extraction or for bone grafting or for tooth replacement options is what I'll say. But that's where you get into that conversation about a single tooth implant. So if you're going into marketing and you're just thinking on the surface level, I want to market this and other people are saying that this method is working, so this is what I want to do, and I'm going to price shop across the board, and then I'm going to just hire someone and hope for the best. It probably won't work out well for you. And if you're at a point where you're like, I just don't know if my strategy is really what's in my best interest anymore. I'm spending this money, I'm paying this company. Maybe it's bringing in leads, maybe it's not. So it's super important that you think about, do I want to have price-driven ads or do I want to communicate value? If you're going the route of communicating value, you need a video ad. You need something that emotionally connects with people, where they are picking you because they trust you, because you're their person. And so if you're going the social media marketing route and you're marketing implants, you're playing the long game, which is fine. But you've got to invest upfront in setting it up properly. You've got to invest in the creative message that's going out and connecting with people emotionally. Listen, the quickest, cheapest way to get this going is to sit down with your patients who you've restored their smile, you've changed their life, and have them give you a video testimonial and run that as your ad, with their permission, of course. Run that as your ad. And if you're like, well, none of my patients would do that, you know what? Start doing some pro bono work. I know it's expensive, but it's great marketing. Change someone's life, get them on camera, get them talking about how you changed their life and why they trust you and why and how they smile now and how comfortable the whole experience was. Get them on camera. Your patients can be your best marketing, especially for these life-changing services that you offer. And also, when you come into a marketing planning session with me, please come in with an open mind. Let me work through my process. You will get more value from that than if you come into the meeting, with this, I just want to quote. I will guide you. I will give you advice that whether you work with me or not, you're going to be able to apply that to grow your business. So go into it with an open mind. No, I'm not an aggressive salesperson. I don't follow up with people aggressively. It's not because I don't want to work with you. I just approach each day with the mindset of how can I bring value? How can I help the people that I'm talking to? So I hope this information was helpful. If you're about to embark in marketing for dental implant cases, big cases, targeted marketing, all of this information is applicable to you. So have an awesome day. Thanks for being a part of my group. And if you find value in what I'm doing, add your friends, add your dental friends, and let's share the info. Thanks, guys.